Hi guys, it's Fatia Johnson, nurse practitioner and owner of Glow and Sparkle Aesthetics and Medical Spa. Today we are going to talk about microneedling and the differences between the different devices and modalities that are currently out there. So with microneedling, what does it do? It's a tiny little needle poke that goes into the skin to help rebuild collagen and elastin, okay? Some of the modalities that have radio frequency with the microneedling also help tighten the skin. So it's going to tighten the jowls, the neck, the cheek and whatnot. So microneedling alone, for example, like skin pin, you glide that all over the face to make tiny little microscopic wounds to help build the collagen elastin. Like I said previously, when you add the RF or the radio frequency, which is a bigger device, it's more of a stamping. So not gliding it, more of a stamp, stamp, stamp around the face. The needles go a little bit deeper into the tissue of the skin, and then they have that heating component which helps to tighten the skin. So depending on what the client needs, depending on what their issues are. So if somebody came in that was younger, had more collagen in their skin, they just want somewhat of an improvement, maybe have some mild acne scars, regular microneedling is fine. Of course, we would need a couple sessions. I like to tell people anywhere from 3 to 10 to 15, depending on what we are treating. RF microneedling is going to be for those that have the deeper wrinkles into the skin, have some laxative skin that we want to help tighten, have some deeper pitting acne scars that we want to treat. Maybe those, those lines above the lip, the upper lip lines or smoker's lines, deep lines in the glabella. So that I really want to get deeper into the skin and help with some tightening. Again, one session of RF microneedling equals anywhere from 5 to 10 sessions, they have said, of regular microneedling alone. So if that is something that someone else is looking at, say if a client wants to do their sessions very quickly and get it done sooner, I would lean towards RF microneedling because then they can get their sessions done quicker and see results sooner as well. At our practice, we have a combination of both. We do have regular microneedling and we do have RF microneedling as well. You can also always add PRP, platelet-rich plasma, or PRF, platelet-rich fibrin, to your microneedling sessions or RF microneedling sessions, as well as at the end, you can go ahead and inject that plasma or fibrin in the face or wherever they need it. That also helps to give an additional collagen boost to the skin, to the face, wherever you apply it. So check it out, RF microneedling, regular microneedling, they're all great options to do to help build collagen elastin and tighten the skin for RF microneedling. It's an amazing option. I always add it on to clients, especially if they are doing neurotoxins, because as we know, neurotoxins only treat dynamic wrinkles. We also need to work on static wrinkles, which is what microneedling and regular microneedling and RF microneedling does for the skin. So it's a great option to add for all of your clients. Check us out on our Facebook channel, Instagram, and YouTube channel. Thank you guys for tuning in.